43. Again, it's way too early to make any great pronouncements that Travis County is on the downslope, but since about April the 2nd, it looks like their numbers of people testing positive is definitely going in the right direction. Next slide. So Webb County looks kind of like El Paso in that the angle of the blue line continues to go upward at a degree that shows more concern about Webb County. Again, the raw number of people testing positive is not as high as it is in the larger counties, but it's still too high. You can see the red line continue an upward trend, although the last, pretty much almost the month of April, has not been going up too much. It's been the high daily number count has been relatively even from 18 to 15 to 16 to 20. If in Webb County they're able to try to keep a lid on the number of people testing positive to be no more than around 20, it will show that they will begin to gain control of it, and that blue line will begin to flatten off at a slower degree. But it is an area that we will be watching carefully, and again, we'll be doing whatever we can to assist them in Webb County. Next slide. So this is important right here. This is exactly what Dr. Zerwas was talking about at our last conference when he talked about doubling times. So, in fact, Doctor, you'll do a better job of describing this than myself. Why don't you explain to him what this shows?
Thank you, Governor. Basically, what we're looking at here is the period of time that it takes to actually double the number of identified cases. And so, if you look way back in something like Italy, early on, that doubling time was 1 to 1.5 days. Incredibly fast rate of increase in new cases. And so it's pretty common in the epidemiological circles to look at doubling time. Our time started out when we first started really addressing this around 3 days. So we started out certainly in a better place than New York or Italy started out. But we've continued through the measures that the governor has put in place, seen that time increase significantly over the past month. And so to go to this level over a period of a couple, 3 weeks' time is really evident that the efforts towards distancing ourselves, staying out of high-density congregated areas and so forth, good hygiene, all things that the governor and Dr. Hellerstedt like to talk about, they really do have a profound impact. And if there's something that shows that really better than anything, I think it's in fact the doubling time that you see here.
Thank you. And so one thing that I know people want, they want to see signs of hope, signs of success. This is a mathematical sign of success. That line going down is so important. That line going down means that we're slowing the pace at which COVID-19 is growing in the state of Texas. We want to see that line continue to go down in the coming weeks, which will be a further signal that we have bent the curve. Next slide. That's it. Very good. So picking back up with some things that I talked about and expanding on it a tiny bit. As I mentioned, I spoke with Vice President Pence for the second time this past week. We talked, I mentioned about Harris County, but more broadly we talked about the state of Texas, and they remain concerned about the state of Texas. They want to make sure that they in the White House and nationally, they're doing everything they can to assist Texas in its ongoing fight against the coronavirus. And so we talked about the strategic use of more federal resources where needed to make sure that we will have the capability of responding, whether it be with regard to testing or other types of strategies. And I want the Vice President to know how much Texas appreciates what he and the President are doing to help the state of Texas. Additionally, however, I want to point out that even though the federal government is providing more resources for things like testing, a lot of the testing equipment, supplies, etc., really are being provided by the private sector. When the early response to the coronavirus began, almost all of the testing capability was coming from the federal government. In the aftermath of the early response, we saw a very prolific increase of the capabilities of the private sector to both produce the testing equipment and to disseminate the testing whereas initially it was public health authorities. Now public health authorities continue to provide testing. FEMA continues to provide testing. But most of the testing that's taking place is done by the private sector, whether it be private healthcare providers, these drive-through facilities that you see seemingly to increase across the state of Texas on a daily basis. And it will be these private providers that will help Texas continue our increasing in testing across the state. I mentioned with regard to Harris County, but now I want to expand what is going on with regard to the collaborative efforts of the Texas National Guard, working under the leadership of General Tracy Norris, as well as working in collaboration with the U.S. Army Corps of Engineers. They continue to identify and set up additional healthcare facilities and testing sites across Texas. One location they're working with right now is the area of Beaumont. And earlier today, I got off the phone with the county judge in Jefferson County, and we talked about what was going on in the area, and they were a little concerned about hospital capacity, and they wanted to make sure that they would have available to them all healthcare capabilities in the event that they continue to have more and more people test positive. And so we talked about ensuring that Texas would collaborate with Jefferson County and the multi-county region in that area of Texas to make sure they have everything they need, including, I emphasized to them, that Texas has plenty of ventilators. If they need any ventilators whatsoever, know that their every need will be quickly met. And with regard to the National Guard, as we speak today, there are 1,058 National Guard who have been deployed across the state of Texas to help in the response to COVID-19. Well, to address a very meaningful concern that we have, as I mentioned earlier, we have these doctors, these nurses, these healthcare providers. We have law enforcement officers. We have other first responders that they have to be on the front lines every single day to help us respond to the coronavirus. An issue they have to deal with as they go to the front lines. For those who have children, what happens to their child during the course of the day? What happens with their child care needs? To better address that and to assist all of our essential workers, today we have launched an online frontline child care portal. This is a project of the Texas Frontline Child Care Task Force led by Elaine Mendoza. Elaine Mendoza is the chair of the Board of Regents for Texas A&M University. And she is working with the Texas Workforce Commission, the Texas Health and Human Services Commission, the Texas Education Agency, as well as the Texas Higher Education Coordinating Board. The portal that they established features a map of licensed healthcare centers to help essential workers find a provider close to their home or close to where they work. This frontline child care portal enhances our child care capabilities, and it allows these essential workers to be able to focus on keeping us safe while also providing the critical services that we need to operate our state and to help people remain safe. So, some numbers. Overnight, about 1,000 child care spots were filled. Currently, there remain 88,450 slots that are open. 13,027 infant spots, 22,281 toddler spots, 28,184 pre-K spots, and 24,954 school-age spots. We have a total of 3,298 providers that are open in 153 counties around the state of Texas. We urge all of our essential workers to look into this service and utilize this service to ease the strain on you and your lives so that you're able to focus on what your fellow Texans desperately need, and that is your efforts on the front line. Now, there's an agency in the state of Texas that is particularly inundated at this time, and that is the Texas Workforce Commission. This is the agency in charge of responding to all the unemployment benefit claims that have been filed. And there's been a record, all-time record, smashing record number of people who filed for unemployment benefits. So much so that in order to respond to it, the Texas Workforce Commission has added hundreds upon hundreds of additional employees and now have staff members from both the Texas House of Representatives as well as the Texas Senate aiding in the response. And they're now working 7 days a week. Well, let me tell you about what's been paid. Already, there have been 363,335 claims paid that total more than $250 million. It's $318 million already been paid out. Thanks to Congress and thanks to legislation signed by the President, the amount of benefits being paid out will be larger in amount and for a longer period of time because of the extra money provided by Congress and the President. Now, I continue to go about the process of suspending certain laws where needed to help Texans respond and deal with the challenges of the coronavirus. One that I did since we last met was an executive order to allow for the appearance before a notary public using video conference calls. This is very helpful for doing things like executing wills and trusts and other legal documents in ways that prevent people from gathering when you're supposed to have these witnesses witness it in person. Now you can do it by witnessing by way of video conferencing. And let me just add this, and that is all of us, we need to work together if we're going to be able to solve our challenges. One way that we work together is by recognizing the need that we are all collectively responsible for the health and safety of our fellow Texans. And it's you, your family, and their lives that are on the line that you have the personal ability to do something about. By continuing to work together while remaining apart, we will save even more lives, and we will turn more quickly to restarting our resilient economy to help lift up every family in the state of Texas. With Texans helping Texans, with Americans helping Americans, we can conquer this coronavirus outbreak. I want to thank every Texan who is heeding the call to stay at home if they can, knowing that you are making a difference in bending the curve on that chart. You're making a difference in the lives of your family and your friends. Though the cost has been high for families and businesses, and each life lost cuts very deeply. We've learned in past disasters that from suffering comes perseverance. From perseverance comes character. From character comes hope. And as we head into Easter weekend, I'm filled with hope, knowing the character the Texans have shown in responding to the coronavirus in Texas. Thank you. Next to Dr. Hellerstedt.
Thank you, Governor Abbott. I share that hope, and we should always, though, be able to explain the reasons for our hope. And the governor has laid that out for you. This is very powerful information that he has provided you. This is objective information. He's showing you that there are places in the state where some of the rate at which it's spreading is beginning to slow down. He's showing you other areas of the state where we still have work to do. This fight against COVID-19 has been compared to a war, and just like a war, you don't stop fighting until you know peace is at hand. And right now, we need to continue to do the things that we have been doing that are leading to these early signs of success, that are leading us into that hope. And we really should be very optimistic about it because the sacrifices that we've made are working. The social distancing is working. We're decreasing the rate at which the disease is growing in our state. But that doesn't mean it's over. That doesn't mean that there still isn't momentum behind it. And we can't give up. We need to keep doing what we're doing until we're absolutely certain that we have COVID-19 under control in every part of our state. Thank you, Governor.
Thank you, Doctor. Dr. Zerwas.
Thank you, Governor, and I would also share that message of hope and optimism. I'd like to just speak and shout out to all the healthcare industry and the work that they're doing to make beds available, to make intensive care units available, ventilators available, and to make their expertise available. They're at the front lines seeing patients as they come in. We have seen that steady rise, but not a rise that's disconcerting to us. But just know that your healthcare industry has had basically it's all focused on COVID-19 now. They've stopped their elective surgery per the directive of the governor, which is the appropriate thing to do, and there is capacity there to manage if we see a surge. And in fact, if it even goes beyond what they have, you'll see when you talk to some of the various healthcare sectors out there, they've planned for that. They've planned for when they hit a certain capacity, they know they're going to need to move to another area. I'm very pleased with that. I'm very proud of what they've done. And I know, Governor, that should we see a bigger surge at some point in the future, by virtue of your leadership, they are ready and prepared to handle that.
Thank you, Doctor. Chief Gibb.
Thank you, Governor. I want to echo the thoughts and the thanks of the Texas Military Department, General Norris and her team, the work that they're doing to increase our productivity, the Texas A&M Forest Service that are helping with logistics to get all the supplies shipped out. A lot of our first responders will not be with their families this Easter weekend, and my heart is out to them and my gratitude to them. We're continuing to work with FEMA and the federal partners at your direction to increase the testing capabilities. We hope that in the Houston-Harris County that number will more than double within the next few days. Very good conversations with our friend Tony Robinson, the regional administrator, and all of the work that him and his team are doing. But I need to thank the TDM team as well that are on the front lines out there every day. So we'll get through this.
Thank you for that. Thank you for your leadership, and we'll take some questions.
Start there. Just do one at a time and Mike.
Can you tell us how important testing is going to be towards reopening the economy? Are we going to have most Texans able to test whether or not they have COVID-19 before they're able to go back to work?
So we will be talking more about that next week when I make my announcement about what opening up looks like. That said, I will tell you that testing will be a component of it, and we will operate very strategically. We want to open up, but we want to open up safely, knowing that if we do it too fast without the appropriate strategies, it will just lead to a potential closure because of another outbreak of COVID-19, but more about that next week.
We've heard from local officials, that tests and PPE are really the things they really need more of. And just with limited testing, that it's likely the number of positive cases is higher than what's been able to be confirmed through testing so far. And you'd announced that Abbott Labs would be sending thousands of tests to Texas hospitals, but we've heard from local officials they can't get clarity on where those tests are being sent, and they don't really have info on that. So is there any more details you could provide on where tests like the ones from Abbott Labs or private industry is being sent, and just what criteria is being used to prioritize where those get sent?
Sure. So first, with regard to the Abbott Labs, they are going out. I've spoken to the CEO of Abbott Labs about that, and they are deploying those in part at instructions by Federal Health and Human Services. And so it's not as if anybody and everybody is going to have access to it right now. The initial deployment, again, is based largely upon federal guidance, but as you may have seen, the Abbott Labs capability is increasing dramatically to, I think, is it 50,000 per day?
I believe that's
Yeah, and that will be coming soon. And so their deployment will continue to increase. And the future deployment of that will dovetail into what was previously asked about what testing will look like going forward. Second, with regard to the total amount testing, understand a couple of things with regard to total amount testing, and that is the primary goal of testing is to identify if someone who seems to have symptoms of an illness that could be consistent with COVID-19, that they get tested, so they get identified, so they get isolated, so they don't contaminate anybody else. If you are someone who has no symptoms, like, I'm curious if I may have COVID-19, let me go check it out. You don't fit the criteria in Texas right now to be tested. And there's a very scientific medical reason for that. And that is, if you have no symptoms whatsoever and you get tested, that test is kind of worthless because you could contract COVID-19 later on that night or the next day. And you have to be tested again once you show some signs of symptoms. Similarly, if you have symptoms of an illness, let's say you have a fever, is that fever because of a respiratory infectious disease, or the fever really because of some other type of infection that you have in your body? By talking to your doctor will be able to advise you about that. And speaking of which, one thing that Dr. Hellis has made clear, but I saw the Surgeon General for the United States of America emphasizing this point last night. He said that if you have concerns that you may have the coronavirus or COVID-19, do not go to the hospital, do not go to your doctor's office. Instead, call your doctor. They don't want anybody who may have COVID-19 infecting what could be a waiting room for either a doctor or other healthcare provider. Call your doctor. Your doctor will be able to talk to you about what your symptoms are and see whether or not you might test positive for COVID-19, and then direct you to go to a location where you can be tested for COVID-19. All that said, let me emphasize this point. Some other mathematical points. It's the mathematical points of what I talk about every day. So as of today, we have a total number of people of 1,532 people who are hospitalized for COVID-19. So the number of people hospitalized for COVID-19, those people are tested. And because we see a steady rate of hospitalizations and a lower rate in Texas than what we see in some other states percentage-wise, we know for a fact what COVID-19 looks like in the state of Texas. And then there's another numerical fact, and that is the number of deaths connected to COVID-19. Because we are seeing a low number of deaths and a low number of hospitalizations in comparison to other states, and in comparison to the positive test rates of other states, it means that...
We're going to break away here from the governor right now and take you over to Mayor Turner for his daily briefing. He's over at Lakewood Church today, taping a segment to air on Easter Sunday. Let's listen in to the mayor's comments.
Live streaming and won't be having people in the audience, and so I want to thank them for that. Let me give you just the latest numbers. Today we are reporting 68 new cases, and 2 additional deaths, and that brings the death count in the city of Houston to 16. 2 cases. One is a woman in her 90s, African American.
From the doctor's perspective.
Yeah, thank you, Governor. If I might add, think of it this way. Testing definitely has a role. There's no doubt that it's important. There's no doubt that people want it. But just imagine that if I could test and we could test every single person in Texas this afternoon and determine whether or not they had COVID-19 by itself, if we didn't do the things we're asked to do in terms of prevention, the disease would continue to progress. So testing has a role. There's absolutely no doubt about it. And it has some very specific uses that are very critical. But at the same time, the important message is about prevention. It's about the social distancing, the hygiene, and the sanitation of common areas, the things that we touch in common with each other. Those things are working. You saw the objective evidence of how this is working mathematically, if you will. And I think that's very powerful. We should be hopeful about it. We should understand the role of testing, that it has its context, but the prevention is really the task at hand.
Mm-hmm.
Hi, Governor. I wanted to ask you a little bit more about the El Paso graph that you showed earlier.
Mm-hmm.
Obviously, El Paso's trend is a little bit different than some of the other large counties. Our curve wasn't flattening quite the same degree. In your conversation with the mayor, you mentioned a couple things, but did you get any other indications for why El Paso may be kind of an outlier with some of the others, compared to some of these other large counties, maybe Central West?
Nothing in particular other than the raw number of the people in El Paso is not as high as elsewhere, and is in a way kind of newer to El Paso. So it may be like these other counties where in the earlier stages of it, it'll be in a higher trend, and hopefully as it gets into the next couple of weeks, you will see that trend begin to bend like you did in the other counties.
Oh, yes, Governor. A quick question for you. So Texas is dead last, 50 out of 50 for uninsured women. For example, we've turned down Medicaid expansion. You mentioned just now, your words, that the TWC has seen a massive increase in the amount of people applying for unemployment. So what are you going to do for those people who have or had health insurance through their company that no longer have health insurance through their company? What is Texas going to do to protect those people who used to be able to have access to that insurance but now no longer can get it?
Two things. One is, as it concerns COVID-19, remember this. Everybody, regardless of their health insurance status, will have access to COVID-19 test, COVID-19 treatment, whether it be hospitalization or whatever is needed. All of that is being 100% provided by the federal government directly to the provider. Second, the goal that we have tied to the response to coronavirus is to get those people who used to have insurance through an employer back in the workforce and have insurance by their employer. That said, there have been some announcements. I didn't bring them all with me. I wish I had. Pfizer, for example, has made clear that for those who did have insurance that were covered by an employer who lost their job, they will get Pfizer medications absolutely no cost. And there are multiple examples like that. The bottom line is working together the way that all Americans have done, coming together in response to this, whether it be the private sector or the public sector. We're working together to make sure that people will continue to be covered, and especially as it concerns any type of need they have concerning COVID-19.
Yeah, so Lieutenant Governor Patrick said that he is hoping to reopen some businesses in the Texas economy by the first week of May. Do you agree with this timeline, and what would it take to be able to achieve that?
Sure. So the way that this all works is we all have a desire to get things going as quickly as possible, but we also have a desire to make sure that it's done in ways that are safe. Understanding if everyone were to rush the doors and go back into the job market overnight, we would see an outbreak of COVID-19 again. And that's exactly why I'm issuing the executive order next week, establishing what the statewide standards will be in the coming days about what the approach is. And these are standards, again, that we've been working in conjunction with the White House on to make sure that we are following the suggestions and ideas of the CDC, as well as Dr. Fauci, Dr. Birx, as well as the President himself and the Vice President himself, as well as the economic advisors, Mnuchin, and others, and then also in consultation with Dr. Hellerstedt. Understand that we all want Texans to go back to work as quickly as possible, and we will do so. Texas has always led economically. We will lead economically in response to the aftermath of COVID-19, but we will understand that we will do so in ways that protect lives and promote the livelihoods of our fellow Texans.
Governor, could you just explain really quickly why there are some, or I guess a chunk of golf courses that have been able to stay operational while other sports recreational complexes were closed?
Sure, happy to. So let me tell you what the standard is, and it's a uniform standard, and that is, first, the standard is based upon what was contained in the executive order about essential services. And in the executive order, we exempted essential services from the limitation on being able to do business. Golf courses was not included in that list of essential services. However, we did say that people should feel free to go take a walk in the park to advance their own personal health. So here's the way that's applied, and that is golf courses and the staff that work at golf courses, the employment operation of it has to be closed for a couple of reasons. One, so that you don't have people within the clubhouse, say, who could be transmitting the coronavirus, but also it wouldn't provide a gathering place where people could contract the coronavirus. However, people are free to walk along, or even with a golf club and a golf ball, go along a golf course, public golf course, anybody can, a private golf course. The clubhouse is supposed to be closed, but members who are authorized to be on that premises can walk along the golf course, even with a golf club and a golf ball, as long as they are all maintaining safe distancing practices and following the CDC standards to make sure they're not transmitting the coronavirus.
Thanks, Governor. You have talked previously about some of the actions that you've taken to limit contact in nursing home facilities. and we've asked you previously about some specific cases, but from HHSC, new numbers in the last 24 hours showing nearly 200 nursing and assisted living facilities statewide have at least one COVID-19 case. So far, the agency has not released specific numbers and specific locations of those cases. When can you say that Texans will start seeing more transparency surrounding some of those specific concerns?
Let me ask Dr. Hellestedt first. We don't have anybody here from HHSC, and I'm not sure what, if anything, you all may know about that. I'll try to come back to it.
Well, yes, what I can say about it is that the Department of State Health Services and HHSC regulates the nursing homes and also runs the state-supported living centers, both areas where we have a concentration of people at high risk. And we've been working with them together to do a couple of things. So when an outbreak is identified, we can provide some expertise to help bolster the infection control practices in that area. And then for those many areas of the state where, and many facilities in the state that do not have COVID-19, we're going back and reinforcing good infection control practices. And among other things, the order has been in place for a period of time now about not having visitation in those types of facilities. We know that's a real hardship. It's a hardship for families. It's a hardship for the people that are there. But I would just want to say that there's the most at-risk population, and a majority, the vast majority of those institutions, those facilities are not reporting COVID-19. So I prefer to look at it in a positive light in that sense.